Well, what is a portal system? Portal system means that this is a bunch of blood vessels that go from one capillary bed system to another capillary bed. Now, we talked about the one in the brain, remember, that went from the hypothalamus down to the pituitary, the anterior pituitary, that was called the hypothalamic portal system. Carried blood so that those releasing hormones could go straight to the anterior hypophysis. So that's the only other one in the body. That's one portal system. The other one is this hepatic portal system, and it connects these two capillary beds. Now, whereas this one was trying to carry some hormones, this is going to carry all of our blood that's been through our intestines and carry it straight to the liver to be digested properly. So it looks like this. Now you would think, remember that if remember there's a celiac artery up here and it gives off the hepatic branch of the arteries, the stomach branch, the gastric branch, the splenic branch, and so forth. You would think that blood would all go back the same way and go back into the vena cava, but it doesn't. The venous system of the intestines is different. And what it does is it all collects back up here and collects into this one big vein right here called the hepatic portal vein. So all the blood from your intestines, from your stomach, from your spleen, from your pancreas, from your entire colon, all of that and your entire small intestine all comes back up this way and joins together to form the hepatic portal vein. And then the hepatic portal vein, which is flowing in this direction, flowing up, goes into the liver. And in the liver, it percolates through the liver, and the liver then takes the food and the fat and the stuff out of your food, out of your diet that it just absorbed, and it processes that in the liver. Now, because of that, the liver has two blood supply systems. One is this one, which is bringing it all of this food-enriched blood, but it's venous blood. But there's also a hepatic artery that comes off of the celiac unpaired artery up there and goes to the liver. And that's what brings the liver its oxygen. It gets some arterial blood from the hepatic artery. So the liver has two blood supplies. We'll learn more about that in the digestive tract. The fact is, though, that it all comes up here, it percolates through the liver, and then it goes directly into the vena cava through these big branches, which are called the hepatic veins. So you got to keep the naming right. You got to remember that the blood coming from the intestines and all this is coming through the hepatic portal vein. It goes into the liver, and it leaves the liver through the hepatic veins, which are these guys here, leaving the liver, going into the vena cava, and going back up to the heart. Make sense? I hope.
So do they diffuse to get into that other group?
Yeah, they go into the capillaries and through the sinusoids of the liver. The liver is just a big, it's just a big bag of blood, really. Lots of blood in the liver as it's being processed by the liver cells, and the liver cells are taking out what it wants and putting in what they don't want. So after, and they're called sinusoids because they're little just collections of blood, and then it goes back to the hepatic veins and goes back to vena cava, as I just mentioned. The last thing that I wanted to talk to you about is what I often refer to as the miracle of birth. And it has to do mainly with blood circulation. Think about this little fetus that a number of you have carried to birth inside of you. And that fetus lives inside of you, and it steals a number of things from you. One of the things it steals from you is oxygen, because the baby cannot breathe, right? He's floating around in a bunch of amniotic fluid, a bunch of water. He cannot breathe. He cannot get any oxygen other than the blood that goes to the placenta through the umbilical cord, and it picks up oxygen in the placenta. right? The other system that the body does not use is the GI tract. The baby inside of mama does not eat anything. He's floating around in this water. He may drink a little bit of it from time to time. He may absorb it. It may get turned into urine, which he pees out right back into the same water. But the baby is floating in water all the time and really not getting any nutrition from that. So we have two systems that are completely managed by mama. And in the minute or half a minute from the time that baby comes out of the vagina, what happens? What happens in the first minute to that baby? What? You cut the umbilical cord, that's right. Usually you put 2 clamps on the umbilical cord, cut in between, and now the baby is getting no blood back from the placenta and is no longer sending any blood to the placenta. What else is happening?
Baby breathes.
Baby takes in a breath. And instantly, those lungs, which were completely full of water and had never breathed a breath in their life, suddenly fill with air. Okay? That's pretty amazing.
What happens to the water?
It just goes away.
The body absorbs
They cough it out, and it absorbs it. Yes. And the lungs weren't even expanded. I mean, the lungs were kind of like this, and there was water in what it was, but when they fill with air, they get to be this big instead of completely collapsed. Okay, so there's room for air to come in. So let's think about this blood situation and this blood flow situation that this baby has to completely change in the first 10 seconds of life, or it's going to die. Okay, if the baby doesn't take that first breath, doesn't fill those lungs up with air, is not going to make it. The blood has been flowing out to the placenta through a pair of umbilical arteries. You remember the umbilical arteries, they arose from the internal iliac. So here's the blood coming down from the baby's heart, splits into the common iliacs, splits into the internal iliacs, and then the placental arteries come off of that, umbilical arteries come off of that, go down by the bladder, and come back up to the belly button, and then go out to the placenta. There's 2 of them, one from either side. And then it percolates through the placenta, picks up its oxygen, picks up its sugar, all that good stuff, and then it comes back, goes back through the umbilical cord, through the placental vein, right? An umbilical vein. And where does it go once it gets back into the belly? It turns upstream, and there's another shunt there, and it's called the ductus venosus. And so that blood that's coming back from the placenta goes up this way, goes through the falciform ligament, remember that? And then it goes straight into the vena cava. It does not go to the liver, it does not go to anything, it just goes back straight into the vena cava and goes back to the heart. Baby pumps it around again. Okay? Drains into the ductus venosus. And the ductus venosus then empties into the inferior vena cava. And we have a really nice model over in the lab that you should all look at, because you will see it again. And it shows all of the little bypasses that the baby has just before birth. Now the problem with the baby's lungs, the fetal lungs are collapsed. And because they're collapsed, it is very hard to pump blood into the lungs. It's a very high pressure system. Once we're born and we breathe air and our lungs fill with air, then it's a very low pressure system. And I think I've said before that the blood pressure in the right side of the heart pumping blood into the lungs is only 30/3. That's all the blood pressure it takes to pump into the lungs. It's a very low pressure system. But in the baby, in the fetus, it's a very high pressure system because it's all full of water and they're collapsed. So what happens? Well, baby comes out, baby takes a deep breath, doctor slaps the baby on the butt, baby breathes. Once the baby expands their lungs, then the pulmonary vessels, the pulmonary artery and the vessels that go into the lungs expand tremendously, and that reduces the resistance instantly. So suddenly now the blood can flow into the lungs, which is a good thing, because that's the only place the babies can get oxygen from this point forward, right? So reduce the resistance, allows the blood to flow into the lungs. The rising oxygen calls the duct. Remember the ductus arteriosus? That's the bypass between the pulmonary artery and the aorta, which was another bypass in order to prevent blood from having to go through the right side of the heart and get pumped out in the pulmonary artery where it couldn't go because it was very high pressure. It just bypassed the heart, went straight out the aorta through the ductus arteriosus. Remember the foramen-ovale between the right atrium and the left atrium? That was another place where the blood was bypassing the lungs. And then that thing is going to snap shut and becomes the foramen-ovale becomes the just a little nubbin thing there called the fossa ovalis. Remember, just a little scar where it used to be. And from this instant on, the pulmonary circulation is going to supply the baby with oxygen. So the foramen-ovale closes, like I just mentioned. The ductus arteriosus is a very short vessel between the pulmonary artery and the aorta. It closes, and when it closes, we call it the ligamentum arteriosum. Back in the day, we used to have to operate on babies now and then whose ductus arteriosus did not close properly, and so blood continued to flow through there. It was a problem to the baby, and so we would go in and actually tie it off with a suture so that blood couldn't do that bypass anymore. Nowadays, we have medicines. You give the baby the medicine, and that causes the ductus to close on its own. So here's just a quick overview of this whole thing. Here's the blood coming down from the aorta. The baby's aorta comes down here through the common iliacs, through the internal iliacs, out through the umbilical arteries. There are two of them. And you notice they're called umbilical arteries, but notice what color they are? They're blue. And they're blue because that's as unoxygenated as the baby's blood gets. It goes out here to the placenta, picks up oxygen, comes back through this thing called the umbilical vein. And remember, veins are usually blue, but this one's bright red. Okay, so that's backwards again. It comes up here, it comes in through the belly button right here, turns up, goes towards the liver through what's going to become the falciform ligament right there, goes through this thing called the ductus venosus, goes right into the inferior vena cava, and it goes into the right atrium. Okay? Now it has several ways to leave there. One way, because it's really hard to go out through the pulmonary artery, part of the blood goes through the foramen-ovale into the left side of the heart. Part of it comes out through the pulmonary artery, but then takes that bypass through the ductus arteriosus, which takes the blood straight into the aorta. All it's doing is avoiding the lungs. It just can't flow into the lungs because it's so high pressure, because those lungs are completely constricted. And that just sends it around again to pick up more oxygen. So you've got these two things that snap shut. So once the baby delivers, you clamp the cord. There's no more blood flowing through this area here, so that whole thing clots off immediately. No flow, it clots. The foramen-ovale closes because it's now lower pressure on this side than it was on that side. Now that it's higher on this side, the blood would want to flow in this direction, but it can't snap shut. Same with the ductus arteriosus. It no longer wants to go this way. It wants to go that way, and it wants to go out into the lungs. And that's it. There's the blood flow through the neonatal heart, or the baby's just been born. Foramen-ovale closes. The ductus arteriosus turns into the ligamentum arteriosum there, and off we go. And all of that happens in a matter of half a minute or less. And if it doesn't happen, the baby doesn't make it. And all it really is an incredible amount of preparation all of these things that were developed, like the foramen ovale, like the ductus venosus, all of those things were created with only one thought in mind, and that's to get ready for that 15 seconds of birth. That's the miracle of birth. I've got another slide in there that might help you, just kind of reviews what we've just talked about. There's another slide on different defects that occur in the heart. Probably the only one you need to know anything about is this one here, called a patent foramen ovale, where it doesn't close and the baby's left with a hole in the heart between the left atrium and the right atrium. That can be fixed with surgery, which is a good thing. Okay, that's it. We got to get out of here.